Which of the following, if true, most help explain why acting on the government inspector's recommendations failed to achieve its goals? So what's the context here? Well, we have this IV. It's apparently causing health complications at a particular hospital. So the government says, wait a second. These IV solutions seem to have high concentrations of sodium and potassium. Therefore, we're going to restore the IV solutions to correct levels. Yay, everything is fine until we get to the end. Nevertheless, the patients on the IV therapy, now that the IV therapy is at correct levels, still had a high rate of health infection or health complications. So what's going on here? Well, we need to explain what that can be. Again, explain why. How is it that after changing the IV, nothing happened? And you can see that this was one of those classic examples of there must be another cause. That is, IV health complications. Nope, this doesn't cause it. So therefore, there must be some other cause. And that's what the correct answer is going to look like. A, the change in IV solution procedure meant a number of related legal documents had to be blah. Legal documents, that's just part of life. That is not an alternative cause. The legal documents did not cause this high rate of illness. B, when sodium and potassium levels in the blood fall below their baseline levels, it can damage cells throughout the body by reverse osmosis. I think a lot of people who got this wrong chose this one because they said, oh, there's the alternate explanation. It's so clear because they actually made these IV solutions too low when it came to sodium and potassium levels. But wait a second. We always have to go back and see what the argument says. And it clearly says they returned the IV solutions to correct levels, not levels where the sodium and potassium concentrations were too low. So we can see that one we can get rid of. C, it is typical for a patient's appetite to increase to healthy levels, blah. Again, that's not an alternate cause to a high rate of infection. D, a high proportion of patients at this hospital are older, okay? And older patients are more vulnerable to infections. A high rate of infections can be traced to what? Well, age. So if you're really old, you're more likely to have high rate of infection. Therefore, you can do anything the IV solution is not really going to change much in terms of the percentage of people in the hospital who are getting sick, because people in the hospital tend to be older than in other hospitals. And there is our answer.